Welcome, everyone. Just allowing some more folks to come in the room and we'll get started. Okay. Hello and welcome, everyone. We are so excited to be here representing the Delaware County Breastfeeding Coalition's event for Black Maternal Health Week, The Power of Support. And today we have our amazing panelists who are going to be talking about a variety of issues, including postpartum and mental health, lactation and breastfeeding care, and the importance of support systems, all highlighting the importance of support for our Black families. And so we are so excited to be having this discussion during Black Maternal Health Week. And Black Maternal Health Week was initiated by Black Mamas Matter Alliance. And it was really created to be a week of awareness, activism, and community building, really intended to highlight the issues around Black maternal health in the United States, to amplify community-driven policy and really center the voices of Black families and stakeholders in a national platform, and really to offer opportunities to enhance community organizing. And so we are so excited to be a part of that process today. It's also really been an amazing Black Maternal Health Week because this is the first year that we have gotten a proclamation from the White House really just highlighting the importance and the need of Black maternal health. There was also a proclamation made by Governor Tom Wolf, and we know that that is coming on the heels of legislation and a long-standing fight and advocacy for Black maternal health. That includes some recent legislation coming from Senator Morgan Cephas, talking about that we want to make sure that maternal mortality is one of the things that we're really highlighting in the Department of Health statistics, and that Medicaid coverage should really be expanded to support pregnancy-related and postpartum medical assistance, supporting doulas, the creation of a doula advisory group, and requiring more training around implicit bias. And we know that that legislation is building on the 2021 Momnibus, which is the Black Maternal Health Caucus information and document highlighting the array of needs that would be really beneficial to Black maternal health in the United States. And there's so many aspects of that that really speak to social determinants of health and the ways in which support is so important for our families at national levels, in addition to what we're doing in communities and in our families. So with that, I'm going to turn it over to my co-host, Mia. Mia L. is a education specialist for the Foundation of Delaware County's Healthy Start program. She is the co-chair of the Delaware Breastfeeding Coalition, along with me. And she also is a full spectrum doula and certified childbirth educator. I forgot to introduce myself. I'm so excited to get started. I'm Shauna Williams. I'm so excited to be the chairperson, the co-chair with Mia of the Delaware County Breastfeeding Coalition. I also am a doula, a perinatal mental health therapist, and lactation counselor working in the greater Philadelphia region. And I also am coming out of Widener University Center for Social Work Education, doing work and research there. And so I'm going to turn it over to Mia.
Hi, everybody, and welcome to the webinar. First, I want to go over a couple logistics. The webinar attendees and participants are in silent mode and listening only. We welcome your participation to use the chat feature and encourage you to sign in today by using your name, your organization, so that other colleagues know that you are in attendance. And also, if you would like to be on the Delaware County Breastfeeding Coalition's listserv, please put your email and Katie Kenyon will get back to you. Also, make sure that you are using the chat with all attendees and participants so that everyone can see your comments and your questions. This event is also being recorded and will be shared via the foundation social media page and also sent out to all attendees along with any shared information following the event. So feel free to share this recording with your community partners, friends or family, and others to grow the reach of this important conversation. So I am now going to introduce everybody. And first we have Kamaya. She is a full spectrum doula, a midwifery assistant, and a certified lactation consultant. Kamaya has been a part of the doula industry for 7 years, supporting over 100 births. So yay. Her passion is to empower families to manifest the desires they seek for the growth of their villages in a non-judgmental approach. Lindsay is currently working as the IBCLC at Crozier Chester Medical Center, where she is helping to develop a new lactation program. Lindsay has been working in the field of lactation for 8 years, and she is passionate about helping mothers achieve their individual breastfeeding goals and works daily to ensure the goal is met. Akeisha is currently the Social Services Director at the Foundations for Delaware County, where she is responsible for the oversight of Healthy Start case management, sorry, I can't talk today, and supervisory support to the Foundation's social workers who provide a variety of therapeutic and other related support. Akeisha's background includes a master's in social work and over 15 years of maternal and child health and perinatal mental health expertise. Kaylin is recently turned 19 and is a graduate of Upper Darby High School. She has a set of beautiful twin girls, Star and Sky, and Kaylin is in the process of starting a business and creating an accessory line. So I just want to say welcome to everybody and thank you for being on our panel. And we are going to open up with some questions.
Yeah, so let's get started. Our first question that we'd like to ask the panelists, and what we can do is, if you feel so led, you can come off mute and just respond to the question. But I'm thinking it might be good to maybe start with Kaylin, if you wouldn't mind answering this question first, and then the rest of you, please speak to this. What have been some of the biggest struggles you have had during the pandemic receiving care? And for those of you who are providers, what are the struggles you've been having related to the pandemic and providing care to the folks you serve?
Some of the problems that I've had since the start of the pandemic was it was difficult after I had Star and Sky. It was difficult finding a job that so that I would be able to provide for them, and then a job that was paying like enough to where I could be able to provide for both of them. And also it was hard in the process of getting like my wig and diapers and stuff like that. That's it.
Thank you. Thank you. Any of our providers want to speak to what you've been experiencing?
I think I can just add on the provider side. I think one of the most difficult things for us has been not being able to have that close contact that we're used to having with our families. And so needing to be at a distance, right? But still needing to provide those services has been complicated over the last year. And so we've pretty much moved to virtual services for the most part. But I know that that's one of the things that, you know, my case managers miss is that personal contact that they're able to have with their families.
Follow up. Oh, I'm sorry. I'm Lindsay. You can go.
Oh no, I'll go after you. Go ahead, Kamaya.
I was just saying, like, I know, like, on a doula's perspective, we're big on resources. So a lot of the resources that we had, they've all changed. And so, you know, necessarily, like, as Kaylin mentioned about like getting diapers and things like that. So as a doula, like I had to reframe all of my resource connections that I've had, because even with virtual support, they may not be operating. So just finding the balance and making sure that I'm giving up to information to my clients in a beneficial way and not leading them down the hole further for support has been a challenge.
I would say some of the biggest challenges are during the pandemic, our visitation policy was limited to one visitor, and providing breastfeeding education includes more than just mom and dad. That support also include, that education should also include the family. There's no big secret that Black women are less likely to get adequate support post-birth than any other race. Through my own personal experience of breastfeeding 4 children, I learned how important that support is. When discussing issues like low supply, one of the first things we discuss is stress. Like, how is stress impacting your life? And when it relates to Black women, the word stress and Black women goes hand in hand. And during the pandemic, that increased dramatically. Breastfeeding in the early days is exhausting. Being a new mother is exhausting. So, during the pandemic, it just really magnified those things. But my goal is, when I see my patients, is not only to educate just mom and dad, but also to educate the entire family so that the whole family can be on one page. They can all know that the benefits of breastfeeding and know how best to support mom and baby and value those benefits. And of course, I'm speaking of course just about breastfeeding because that's my specialty. But I recognize the inequities that we face on a daily basis, and I'm doing my own personal part to kind of close those gaps by, providing education, not just for mom, but for the whole family. And I just think that's really important. So I would say, basically, not being able to meet the whole family and provide that education has been one of the barriers.
Thank you. Mia, you want to ask our next question?
Yes. What are some supports you wish you had during or after pregnancy? I know it's a toughie, but if you can think about being pregnant, what was, I guess, a situation maybe that you wish you would have had support if you did not have it, and the same for postpartum. A lot of people don't have a lot of family or friends that live close by that could help support them. So did it look like virtual support, speaking on the phone to friends and family, FaceTime, them sending you items that you needed for yourself or for the baby? New self-care techniques, that might be one.
I'm gonna answer, but I'm gonna go back to when I did have children and I was breastfeeding. But I'm thinking, listening to Lindsay and how, she's talking about the importance of that family support and that family being educated around the importance of breastfeeding and supporting mom. I wish my family would have had that type of support, right? Because I chose to breastfeed, but my family may not have had all the information, right, around how to support me during that time. So
I couldn't agree more. I think one of the things when I think, I have 4 children, but when I think back to when I gave birth to my first daughter, I was a teenage mom, and I gave birth in Delaware. We didn't have free childbirth education classes. So when I sought out some education in the area at that time, this is 15 years ago, it was education, just access to free education, like decent prenatal education. And this is going to be a cheap plug for Crozier, but we do now provide free prenatal education so that anybody that wants to attend, we do a breastfeeding, breathing and relaxation, newborn care, and labor preparation 1 and 2, because education is important. Education makes all the difference. Informed care leads to safe and empowered childbirthing experience and postpartum experience.
I think doulas carry such an amazing role when it comes to support. I know myself personally, I've been to a birth where a mother was in need of an emergency C-section and she had no one there, and I was her only support. So in terms of that, you never know, friend or family, if that person is going to end up in the hospital by themselves because they can't reach anybody, or some people just don't like to admit that they need help or that they need support, so they rather go it alone. And I think that's something that needs to be talked about and needs to be corrected. So the fact that we have so many community partners that offer free doula support, be it, postpartum, birth, and also agencies like the foundation that offer Healthy Start and Nurse Family Partnership to make sure you get that additional education and that additional support.
Yeah, Mia, just touching on what you just mentioned, like on a doula component, during COVID, the pandemic, it has changed a lot. A lot of people, even still today, are not really fully aware what a doula is or have never heard of one. And we're normally categorized into something else that we're not. I had a few clients with the restrictions placed on the hospitals of not allowing doula support and like have to say like, oh no, they're family. Change that dynamic in order for, a doula to be let in. And I think that's a big disparity that we're currently in. I also work for Petaway Pursuit Foundation where, we offer those classes that was mentioned of like the newborn education and the parenting classes to help unite the village, to make them feel more powerful in their approach to medicine practice, whether it's a birthing hospital or a birthing center. So just thinking back, as mentioned, like about our personal lives, 15 years ago, when I delivered my first child, it was in a very rural community where there weren't many people like me. And I got an epidural and I had to have an emergency C-section and they told me I couldn't breastfeed my child. Milk is everywhere in the hospital. I don't know what's going on. And there's no direction for me or my military spouse. They're thanking him for his service, but at the same time, right after my C-section, they got me up to walk to the bathroom, and I fainted. So I had a lot of disparities naturally with my birth, which ultimately led me to become the person I am today. Because if I can go through this as educated as I was still uneducated to the needs that I had of being just a regular human being. And so with the breastfeeding journey, that was also a struggle because it was something foreign to my family. So my in-laws were like, give a bottle of Carol syrup and carnation milk and all the above. And I'm like, whoa, wait a minute. Now my baby is struggling with, feeding. Now they have digestive problems because of what the old wives tell us that we wanted to continue on. So I think it's important to even just bring a little reflection and to say to others, like, we are your reflection, like we're here for a reason. We're providing this encouragement and this empowerment so that you can feel and know that we've also walked in your shoes or we know someone similar to do so, but there is hope at the end of the tunnel. And so I really, really appreciate just the forum to be able to know that it's so much growth and empowerment within the African-American culture.
So Kamaya, I have a follow-up question from the chat box, and you would be the perfect person to answer this. What is the difference between a doula and a midwife?
There is a big difference. So a doula is there for me, and I know I don't do like the traditional what the Webster dictionary say when it comes down to defining a doula. So as a doula, I'm a support person. I'm here to educate you on what you may experience during your prenatal and postpartum, and even your delivery, to empower you to be a voice of reasoning for yourself. I can advocate for everyone until they're blue in the face. I have no power, but when my voice stops, I need you to feel empowered enough to speak up for yourself. So in the doula component, It's more so for the empowerment and making sure your village understands your needs and just beyond the doctor's office. A lot of people advocate, oh, you got to tell a doctor this, but I mentioned about my own journey with breastfeeding, and my family couldn't help me. And so how can they advocate for me properly? So for a doula, it's more so of the empowerment and education piece. As a midwife assistant, it's a totally different environment. So a doula will not deliver your baby, but a midwife assistant under the supports of a midwife, I am able to do that, whether it's in the birth center or in the home birth setting. So that's a big difference in the two. Your doula cannot deliver your baby, guys. We don't want to go to jail. We can go to jail for that. So we don't want that to occur. But under a midwife's direction with a midwife assistant, that can take place because you're having the supervision and supports. Think of like a doctor to a nurse when it comes down to a midwife assistant. If you've attended births, the nurse can push you down and then the doctor comes in to deliver. So think of it in that component for a midwife assistant.
I always tell people a doula is from the belly up. We're more emotional and physical with the support. And a midwife is belly down. They can help you, catch the baby, and that's their part of the job. But we are more mental and physical and emotional only because, we're doing comfort exercises. So if we need to hold you for 2 hours, that's what we're doing. And not to mention, 24 hours being awake, if that's the point, but we do, it is very different. Did anyone else?
Being a teen mom, like the first time I got pregnant, I was scared. I didn't know who to talk to. Most teens, when they get pregnant, they don't really want to go. I grew up without a dad, so all I had was my mom, and I didn't want to talk to my mom about it. But sooner or later, I did talk to her, and during my pregnancy, I did have a doula, but I didn't have somebody to open up to because I had a doula, and from the start of my pregnancy, I had a doula, and I would open up to her, and every other week or every week, I kept getting a new doula, and it's hard to open up to new people about how you're feeling. So that was one of the biggest things that I struggled with during my pregnancy. I had all my feelings bottled up because I didn't know who to talk to. I don't have many friends. It's scared talking to family. So that was one of the main things that I struggled with on the support side.
Kaylin, I'm so glad that you shared that. That actually leads us into our next question. I did want to just follow up. There was another question in the chat, and maybe we want to take that quickly about the state of Black midwifery in the country. And Mia did put, yes, there's definitely Black midwives. Does anyone want to speak to that and their knowledge of that? I'm interested in your thoughts about that, Kamaya, as someone who is a midwifery assistant.
So African-American midwifery is definitely on the rise. I do know of one practice that is in the Philadelphia area that is, there is a Black midwife that supports communities, and families, but there are midwife assistants. You can still find an African-American midwife assistant in a hospital setting as well. You just got to kind of do your research. They're definitely around, and the practice is pretty extensive. So it takes a lot to become a midwife. It's not as traditional as it would be to become like a doctor, but there is a lot of steps that go into becoming a full-blown midwife.
Yeah, thank you for that, Kamaya. There's definitely a long history of Black midwifery in the United States. And unfortunately, there is not as many Black midwives around as there was then, but they are definitely working towards resurging, having that as an option for folks. So that was a really good question. Kaylin just was talking about her village, the people who support her. And Kaylin, I welcome if you want to add more to this, because our next question is, tell me a little bit about the village that was supporting you during your birth experience. What did your village look like? And while you're thinking about what you may want to add to that, Kaylin, I'm wondering for our providers, think about the clients that you serve, the ones that have a really good, strong village, and the ones that you are seeing they are struggling a bit. And maybe you could give us some examples of what you're seeing. And I'm really interested in how that looks during the pandemic. How is the village able to connect with our families?
I would say that my village was a strong village, but it was a bit shaky because although it was my mom, it's like being a new mom, everyone thinks that they can tell you what you have to do to raise your kids because they had kids before. They're telling you like what to do, and you're like, oh my God, I can't like it's like it was complicated. And then although it was like a very strong supportive village, the people in my village like had disagreements. So it was like stressful on my end because like they're my support and I don't want to have to pick between either or. So it was strong, but it was shaky on the other hand.
I have a follow-up question for Kaylin. So you said it was shaky. Now, under normal circumstances, um, people usually go home with one. You had two. So how I imagine that was much more difficult for you, being that you had that. And did anyone in your family have experience with twins and they're trying to give you advice or no? Okay.
No, nobody. I'm the first out of all my siblings, my mom, my grandmom. I was the first to have twins. And yes, it was hard. Like first night out of the hospital, no sleep, had to wake up every 2, 3 hours to give a bottle. It was stressful. And then I was like, I had moved out and I was on my own. It was just me and my kids and a dad. So it was just us four. And it was like sometimes it'll get overwhelming and you like want to walk away, but you can't because you have the kids, you have to make sure they're okay. So it was stressful. And no, no one had twins. So I'm like, you don't know what's going to happen for sure. Like you had experience with one and I'm bringing home two. So it will be kind of harder.
Thank you, Kaylin. That was such a powerful testimony, that experience of being a mom of multiples, definitely. Anything our providers want to add? I'm so interested in what you're seeing in the clients you're serving.
I'll just add that we have a lot of young families like Kaylin, right? In multi-generational households. And so we have families who have a lot of support, right? Because they're in their those type of households, and we have families who have a little support. But one thing that we've noticed and that's been kind of heightened and impacted over the last year with COVID is, with those multi-generational families, the amount of people coming in and out of the house, right? And COVID being transferred from person to person in the house. And so we've had to work with a few families over the last year to try to separate some of those families so that, our families aren't impacted as much with, those multi-generational families, those people who are coming in and out of the home and continuing to be transferring the virus back and forth to each other. So that's something that we've seen in the last year that's really really impacted our families.
And I'll go ahead and piggyback off of that and say, yes, same thing. That's what I'm seeing. Mothers that may typically would have had more support, prearranged to have less support because of COVID. They wanted to reduce the chances of infection. So where they would have had mom, grandma, now it was just dad. And while dads are absolutely amazing, sometimes it's nothing like the support of your own mother or your grandmother. So yeah, it's been a bit of a challenge.
And just to quickly follow up, just thinking of a doula perspective, I actually like to specialize in like young adults for my practice and providing that education to them with that village. A lot of them don't even know what a village is, or it's just a natural, oh, my grandmom is here, or my other siblings are here to support me. But that support normally looks different to a young parent, and as Kaylin mentioned, like with her having two and coming home and expecting the support, that she may have envisioned and it wasn't the same, that can definitely impact, the direction of support that she needs, of being able to speak that, of trying not to disturb the peace in her home, being able to speak up about, hey, I need help with this bottle. I'm exhausted. I heard her say that. And just because you're in a house, a lot of people forget, like you can be in a house full of people, but no one hears the screams and they can be sitting right next to you. So, with Caitlin saying I moved out and it was just me and my two children and no one has experienced in my family on my side of twins, I heard like, Dag, I wish I could have been there to support her in my doula role, to show her that you got this, to make her feel the empowerment that she needs in that scope at that time, to know my place and know when to jump in. I have a picture of my phone of a fire hydrant. I allow that fire hydrant to represent me as a doula because it's a pin in there. You can pull that pin when you need because it's an emergency, but do note that that emergency, device is always here by your side. So I kind of reflect myself as to being that fire hydrant to let, my peers or my clientele know that you have what you need inside of you, but sometimes we need that push to bring it out. And I feel like Kaylin like naturally had to bring that push out for fear of, of judgment. And that's so common in the Black maternal side of things, to say I need the help and not knowing how to get it. But I'm happy that Kaylin feels comfortable enough to share her journey. But that's what douling is all about.
Right. And I want to also say I'm proud that we have a lot more opportunities that can give people the information and the resources that they need. Because at one point, and some of my colleagues know this, when I was 19, I was pregnant and I didn't know that I was pregnant. But I ended up losing the baby, having the baby no longer had a heartbeat. So I went through this whole situation by myself, not knowing I had other options. I did not know, I was 29 weeks, that I could deliver my baby. I did not know that I had the option of, would I like to, carry my baby for further on, or would I like to give birth to my baby and hold him, or, you know what I mean? I didn't know the other options. I didn't know there weren't bereavement doulas then. So I'm thankful for the foundation and Healthy Start and Nurse Family Partnership and Petaway and Crozier and so on and so forth, doulas and midwives, because they are giving us the information and helping us to advocate for ourselves, empowering us, and that is what's needed right now.
Lindsay, did you want to add to that?
No, I was actually just reading the questions. Sorry.
I just was too. That's why I went there. I wanted to check in. There was a question about, are doulas additionally trained as social workers or therapists? And I can answer that question because I do happen to be a doula who also is a therapist, a licensed clinical social worker, but that is not necessarily the norm. Doulas are often specifically trained in Kamaya. I'd love for you to speak to this as well. Really in that midwifery model of care, really around providing that perinatal support, the emotional support, and having that knowledge of birth and the postpartum period to really support parents. It is not a common thing that you'll see folks who also have that other source of training along with it. But there is a wonderful doula that I know who said recently to me, I'm kind of a low-key counselor. And it's so true that a doula really comes with her heart, right? And doulas really come with their soul and spirit to that work and offering emotional support. And as Kaylin was talking, I'm looking at all the providers on this panel and I can see all of our hearts like, oh, we want to be there, right? We wish we could have been, because we often come to this work, particularly as Black women, we come to this work with another level of really having that passion to meet you in that place of pain and power.
I completely agree with you, Sean. I'm laughing because of that, you know, the comment, the low-key therapist. So I think for doulas, I can definitely speak for those that I'm connected to. We enjoy what we do, so we want to make sure we're up to date on everything when it comes down, because we don't want to give you outdated information, and information changes daily. But it is natural for, as Kaylin mentioned in the beginning, you know, for our clientele to lean on us a little bit more than they wouldn't traditionally do to a family member or a colleague or friend, because we propose that this is a safe space. You can come and vent to us. I let my clients know you can text me with your venting and just put venting at the top, so I'm not in 911 panic mode when, you know, the text comes through. So just having that natural outlet of letting them know it's okay to vent. Their surroundings isn't telling them that it's okay to have their concerns. So in the doula component, we're here, but naturally it can be deemed as us being a therapist or a social worker, because what do social workers do? Provide resources. What do doulas do? Provide resources. What do therapists do? Talk. What do doulas do? Talk. So it's easy to, you know, put us into that category, but no, we don't wear those hats. You know, that's out of our scope of practice or out of our pay grade, as I like to say too. The support.
Okay, I have a follow-up to the village question. How do fathers fit into your village and the birthing process? Kaylin, was your partner a big support with the birth of the twins in the process?
Yes, he was. During labor, I would say was the most like important time that I needed him, because I thought I was strong enough to just go natural without an epidural or anything. And I was like in a lot of pain. And I just like, sometimes you just need somebody there to just hold your hand, let you know, like, it's gonna be okay. It's gonna be worth the pain in the end. So yes, he was there. And then after the birth, like, you're tired, you're drained, because I had to go 8 centimeters and then last minute have an emergency C-section, and recovering was the hardest part. Like the pain, and then I'm tired trying to sleep, and the baby's crying, had to get feeding and stuff like that, is like when I needed him the most. So yes.
I like that. He was a big support. I do know, in my personal experience of being a doula, some of my clients' partners, husbands, boyfriends were some of the best doulas. I wanted to hire them as doula assistants because they were so good and so supportive, and they just actively, like instantly fell into that role. And I felt like I didn't even need to be there at some point. So there are a lot of male doulas, birth doulas actually, that people aren't aware of, but also postpartum. And men are a big support and can be a big support during birth and postpartum. Sometimes, you know, they might need a little help, but there are resources out there, and the foundation, you know, is one of them. We are starting a fatherhood initiative. Keisha, did you want to speak on that?
Yeah, I just wanted to mention that, you know, we encourage fathers, and we try to engage with fathers, you know, in the beginning of our engagement with our families, right? We know how important it is to mom's health for dad to be there and be supportive mentally, physically, emotionally. Like Caitlin said, you know, he was there for her in a few different ways, it sounds like. We know that's important from the beginning, right?
Mm-hmm.
Even during pregnancy, prior to pregnancy. So we try to encourage our families, one, to first plan out their pregnancies, right? Because we want you guys to plan these things out and know what your life is what your life wants to be like in the next 5 years, in the next 10 years. And so really encouraging dads to participate in the home visits, the education, encouraging dads to support mom around breastfeeding. So making sure he's also educated on breastfeeding during pregnancy so that, once we get to the baby's birth, he knows what to do, right? And how to support mom, how to bring baby to mom, so that he can, have his own interaction, but also help with the feeding, right? And so we try to encourage these things, not just, during the delivery and postpartum, but throughout pregnancy and the baby's, first few years of life, so that dad can have and build his own relationship with the child.
And I'll go ahead and piggyback off of that. When I first walk in to see a mom, I don't address just mom. I always address mom and dad, because breastfeeding takes a village. As much as we focus on mom breastfeeding, we know that she needs support to accomplish that goal. Mothers that have fathers present are more successful with breastfeeding. I always tell dad, you are the protector of the supply. You are the one that makes sure that she has the right environment, she's in the right state of mind, that she has what she needs to make sure breastfeeding is successful. So yes, one of my most favorite experiences with working with families is watching dads cheer on their newborns as they make their way to the breast for the first time. There's nothing like seeing a dad say, go, you can get it, So dads are vital and important, and definitely integral part of breastfeeding, birthing, and postpartum.
And to add to the breastfeeding part, I started off with breastfeeding at the start. Like, I personally I wasn't a big fan of it because it was two of them, and one didn't like the breast and the other one did. And it was hard producing milk, and then it was just hard overall with breastfeeding. And he was like pushing me to breastfeed. To go off topic a little bit, he did get locked up when they were like 2 weeks. So I was still trying to breastfeed, but without that support, I had to stop breastfeeding because it was tough, because one, like I said, one didn't like the breast and the other one did. So it was like,
Kaylin, you're on mute.
I'm sorry, with the doula part, I personally wish that I had one of you guys as my doula, because my doula, every time the dad did try to get involved, she would swerve around it and mainly focus on me. It's like he wasn't there at all. So yeah.
Oh man, Kamaya, can you speak to you're already ordered.
Yeah, I had to jump in really quick. So a lot of what I practice in my in my doula spectrum is, the dad is important, especially right now with COVID-19, not just the dad, but anyone that you deem as being support. So with the guidelines, with those restrictions of you can't come in with one person, it's my job now to gear whoever you decide to be, in your supports and even beyond, because of how the things have changed. In the hospital setting, they're coming home in a day, C-sections are coming home in 24 hours now, not 72. So how can you properly prepare for that? You may not be comfortable with me coming into your house. You can be comfortable with, telling me what's going on. But when it comes down to, protecting your newborn child in your household, it's important to make that connection. So while I am sad that Kaylin did not have, to me, the support that she desired, it is important to know that normally doulas do operate to want the village to connect together. We'll give you the resources, but I'm encouraging the dads. Like, I'm excited to learn that it's, fathers, males who are doulas now. I'm always advocating for that because it's important. Sometimes people don't understand that the support is needed before the child begins. You mentioned, Kaylin, that, the father had to go and he was incarcerated. He still needs to know what's going on with the child, and most people don't think about that until the child comes. So I love how she mentioned, like, he was giving her the support that she needs, and the doula would normally traditionally give him that empowerment and education. Normally when I'm in labor with my clients, I say, hey, give me the father's number. So, because I want to call him, I don't really want to call you because I don't want to disturb your rhythm that you have going on, and giving him information. So I love to see, like, when parents or fathers are connecting and telling me, hey, the nurse just said this, I don't know what this means, and I'm giving that education and that follow-up and helping them to understand, like, it's a combined decision. It's not just lopsided. Like, your vision matters too. Your concerns are needed to be addressed and heard as well. And how can we go about you feeling as empowered to empower your spouse? So doulas normally do definitely encourage that family or village support. And it's not too late, Kaylin. Even though your babies are here, if you need support, honey, let me know. I'm still here. My head is always on. So you definitely have, the support that you need in me. Free of charge, honey, about the empowerment.
So I wanted to take a second real quick to give a quick shout out, because we do have a couple male doulas, postpartum doulas on here, Jared and Onaje. So welcome, guys, and thank you for your services and continue to support all of the family, actually, as well as the dad. So thank you for that.
Yeah. What I'm loving about seeing male doulas is that it really emphasizes, to Kamaya's point and what we were talking about, the importance of dad, is that we need all the men in the village, right? So grandfathers, brothers, male cousins. I'm a mother of 2 little boys, and I'm like, oh, please go play with your dad and them, because y'all are doing too much. But you really need everybody, right? It's the whole village has to come together to really support our parents. And Kaylin, I'm so glad you started talking about your breastfeeding experience, and Lindsay was already speaking to this, and I would love to hear more from everyone on the panel, because we know here with the Delaware County Breastfeeding Coalition, we support parents getting all of the support they need to make the choices that they need for their infant feeding journey. I'm wondering if we can talk a little bit about what unique barriers have we observed or might have you seen folks experience? Or Kaylin, if you want to talk more about what you experienced obtaining lactation support and breastfeeding, particularly as we think about COVID-19. What are the barriers that are there?
What was the question again? I didn't hear you.
Yeah, I was just asking about what barriers did you experience in your postpartum journey around getting lactation care support?
With breastfeeding, lactation, I didn't really have any support, like, from my doctors or like anybody, really. That's why it was like so hard to continue breastfeeding, because like without that extra push, you're like, I can't do this. So yeah, I didn't really have much of a support with lactation and breastfeeding.
Thank you so much for being really transparent about that, Kaylin. You're adding a very important perspective that we know is happening far too often. Yeah,
so I'll go ahead.
Mm-hmm.
Okay. And I'm so sorry that you had that experience, that you didn't have that care. Every time I hear you speak about, not having that support, I'm just like, oh my gosh, just like she shared earlier, I really wish I could have been there for you. But some of the other unique challenges that I've observed are really during that shortened hospital stay and that reduced community breastfeeding support. There's nothing like that face-to-face interaction. Some things can only be accomplished and be effective through in-person care. So yeah, with those shortened hospital stays, some other problems are some breastfeeding issues can only be identified and addressed over time. So if we have a mom that's leaving within 24 hours, yeah, breastfeeding looks great in those first few hours, the first few feedings, but as soon as she leaves, that's when the issues, they arise. So yes, I would definitely say the shortened stays are one of the most unique challenges that are pretty pervasive right now.
Yeah, thank you so much, Lindsay, speaking to that. What challenges have you seen, Kamaya and Akeisha, and the folks that you serve around lactation?
I'm going to agree with Lindsay, right? That personal interaction that they're not able to get because of, social distancing and everything else. Our case managers are trained as postpartum doulas, but they aren't able to give that personal one-on-one, face-to-face attention, right? We can do it through video, but there's certain things you can't see, you can't, you can't feel, you can't smell, whatever, that needs to happen in person. So I think that's the biggest thing that's missing right now, that hands-on personal assistance.
I think for myself, I noticed like a lot of my clients receive like conflicting information from like the hospital that they delivered at, and then they come back to me as being, their doula and CLC, and they're like, well, they told me like for the feeding, it drives me nuts. Like, they're being educated to feed their children every 3 to 4 hours while breastfeeding. I'm like, no, and then they don't understand like why their child is screaming, it's time to eat, and then they're overwhelmed because they're not understanding, like that's too long. And, the uniqueness of breast milk, they're still treating it like formula. I had a few clients who were encouraged to provide formula to their child because their milk supply didn't come in yet. So I think that it's a lot of misrepresentation around everyone being on the same page. Like if I'm trained to learn that a child should eat every 1.5 to 2 hours, or at least 8 to 12 hours, 8 to 12 times in a 24-hour period. But if I'm telling them that and they're listening to what the doctor says because the doctor knows best, right? I'm now causing a conflict within their home. So how can I avoid that and making them feel like, no, your doctor isn't telling you wrong, but they are telling you wrong. So it's always a hiccup when it comes down to, wearing multiple hats at one time, because you don't want to shy them away from, wanting to connect with their provider, but you want to give them the proper education so that they can make the best decision for themselves. So it's like it's a catch-22. Like you're good at it or you're not, but in the interim, the doula normally has the one that falls at fault with it because they're listening to their provider. So it's kind of like a catch-22.
I couldn't agree more with that statement. Even being in the healthcare, system, from one person going into the room to the next, they absolutely do receive conflicting information. And as hard as we try to provide that education to all providers to make sure that we're all on the same page, it doesn't occasionally, it actually happens more often than not that they receive that conflicting information. And that's unfortunate. It makes it extremely hard to accomplish breastfeeding when you're getting 10 different answers. You're already very nervous. You're very concerned, especially as new moms. We want to make sure our babies are warm and they are fed. And most, takes priority is being fed. So yes, when it comes to babies crying and screaming and they're just not sure what to do and they're getting different conflicting information, they usually resort to formula. And that's not what we want. So yeah, it's definitely a challenge.
And the other thing with that is when they get home and, their grandmom has the things that they did and their auntie has the things that they did, right? They're getting even more conflicting information. And that's where just kind of the information that we give conflicts with the information that their family's given because they have traditions that's been, you know, brought down from generation to generation, and it worked for us. Like Kamaya said earlier, you know, not understanding that, you know, some of these things change.
We rely on our mothers and grandmothers for that education. They were the ones who raised and brought us up. So to, you know, receive information from your provider, your care providers about what you should be doing, and then get conflicting information from your own mother and grandmother is such it's this internal turmoil. And it's really hard to, you know, persist through that. You know, you're already tired. You got this new baby, and, you know, one person telling you, yes, breastfeed, another person telling you, no, the baby's not getting enough. It can make it very difficult.
Right. And then that's when we get into, you know, behavioral health and emotional issues, right? Because I don't know what to do, because there's a conflict. And am I doing the right thing for my baby? Am I protecting my baby the right way? All of those conflicts start.
Absolutely.
What I didn't mention too, guys, was when I was giving my daughter that Carol syrup bottle, she was 2 weeks and it was an 8-ounce bottle. And I'm going off the direction of my grandmother-in-law saying, your baby is hungry. No, my baby was in a cluster feed. They were in a growth spurt. They were everything but hungry. And now she went through, so I felt so, even to date, my daughter's 10, and I still feel horrible, you know, at the fact that I was just listening to my village, and, you know, and my daughter was going through so many different adversities, and I couldn't even do anything. I thought I was doing the right thing. So it was crazy.
So speaking of the village and support, Lindsay, I have a question for you. Does Crozier have breastfeeding support groups? And if they do, are moms and dads given this information?
So we do not have breastfeeding support groups. We do have lactation care, of course, at Delaware County Memorial Hospital and Crozier Chester Medical Center. We have lactation consultants. Yeah, it's a new thing within the last year. And we do have the prenatal education, but we do not have breastfeeding support groups. That is something that I wanted to add, but actually joined Crozier in February of 2020. And by March of 2020, we were in a pandemic. So doing any support groups, we wanted to start with in-person support groups first. So we have not delved into that, but we may pursue doing some virtual breastfeeding support groups. There is some interest for it. Right now, what we do is mainly refer mothers to other places where they can join support groups. And we provide lots of education and resources as to where they can join support groups.
We definitely have a lactation or a breastfeeding support group at Petaway Pursuit Foundation, and it is definitely completely free to service everyone. So if there's fathers who have questions, if there are mothers or any village family member has questions about breastfeeding education, we definitely provide that. It's normally held at least twice a month on a Friday in the afternoon, and it's a free class and it's via Zoom. So we're definitely here to help too and extend that.
Yeah, and the virtual support group at Petaway is getting a shout out in the chat. So good. So yeah. Oh, go ahead. I'm sorry. Oh, I thought you were about to say something, Lindsay.
Oh, no.
I have more lactation questions though, because we got another one in the chat. And Kaylin, I'm wondering, can you speak to what sort of knowledge did you have about breastfeeding and what to expect? Did you learn anything about cluster feeding or about like the newborn stage, what it would look like? Were you able to gain access to that information?
I think like I was tired. So I did have a lactation specialist like come in the room every now and then and talk to me about breastfeeding, because I like I said, from the jump in the hospital, I was breastfeeding. But because of the fact that I wasn't giving out much milk, and like she said earlier, the doctor say, try breastfeeding, then give them a formula bottle, then breastfeed, then give them a formula bottle. It's like back and forth. Don't really know which one, but know about cluster feeding or any of that. I wasn't like, it wasn't said to me. It wasn't like verbally said. They just gave me like a whole bunch of pamphlets and stuff like that.
Mm.
And I'm not really a fan of reading, so it was like, yeah.
Yeah. Thank you for sharing that, Caitlin. That is so real. I'm so interested from the provider end, and Lindsay, I know you were already ready to speak to this. What kind of information do you think is most important for moms to be going home with, particularly as we think about how do we support lactation with Black mothers?
So gosh, that's a loaded question. When I meet with my mothers, you know, during our initial session, it's minimum 30 minutes. There's so much information that needs to be covered about, especially if a mom did not have any prenatal education on breastfeeding. We have to go over everything. We need to go over engorgement. We need to, like, what to expect, how to tell if baby's getting enough, how mom feel, how to tell, signs of satiety, signs of, everything, to tell that breastfeeding is going well. Mom is saying, when she's breastfeeding the baby, I'm starting to feel tired. I'm like, good, that's a good sign. I'm starting to feel crampy. Good, that's a good sign. We have to talk about all those things. It's, there's just so much that needs to be taught. And I go through it all. I don't leave a thing out. So as far as what's important, everything is important. There are so many things that have to be covered. I would be talking for hours if I talked about everything. And sometimes even after 45 minutes in the room, I'm like, darn it, I really wish I had touched on this. Everything has to be covered. We got to talk about, and especially when a mom is being discharged in 24 hours, oh, we have a lot to cover. We're doing a crash course, and I'm talking about things to expect at day 3, day 5, day 10, who to reach out to, what to do if you feel this way. It is just, it's incredible the amount of information we have to cover.
Hi, my next question for you guys is, how has COVID-19 impacted postpartum and mental health challenges within your community?
Mm-hmm.
Well, it's definitely placed a big impact on a lot, because even with the promotion of like the crisis response units, that isn't full. Like it's halfway to me. Like I've called for with a couple of clients, like they needed support, and the direction I was like, well, I'm an educated provider, and I'm still confused as to how you plan on helping these clients. Beyond. And I had a couple of clients who were in crisis, like severe crisis, and to get them to feel comfortable to go outside to get the treatment was a step in itself, of just trying to get them to learn, like, it's okay to walk outside right now. You won't be immediately attacked with COVID, there are guidelines in place to support you. And then with the lack of like therapy providers, a talk therapist, even though they're promoting telehealth, it may take you 2 weeks to get an appointment. And we all know that if a mom is in crisis, they're not willing to wait 2 weeks for this support. And if they're breastfeeding, they're definitely not trying to go through a CRT with fear of being admitted, against their will. And now they don't have the connection with their child. So mental health is definitely on the rise right now, at least for my population that I service. And there's a big disparity within that. Like there's a big gap. The services are there, but the connection is not where it needs to be, at least on my end.
I'm gonna agree with Kamaya. The services are available, but are they the services that people need, right? One of the things that we found was that for our moms, it was difficult to get out. First of all, if you suffer from depression and anxiety, it's difficult to get out in the first place, right? If you have to get somewhere at 7, 8 o'clock in the morning to get an assessment, and I have a small child, I'm not doing that either. If I got to get on the bus to go, I'm not doing that either. So just the difficulty or how much effort it takes to even get, to an appointment or to see a therapist, it gets really complicated. One of the things that we've been able to do was bring in a program called Moving Beyond Depression, which is an in-home cognitive therapy program, in which our therapist is able to go out into the homes and see mom in their own space, in their own comfort, and provide 15 sessions of services with them. That work is being done through teletherapy now, but it's still that same just kind of interpersonal relationship that happens. Once we're through COVID, we'll be going back into in-person, but the fact that people were already dealing with compounded mental health issues, and COVID has come and stacked on top of that, where we're not able to be as social as we were in the past. We're not able to interact and have our regular connections and our regular outdoor activities with family and friends. You know, it put us more into an isolation pattern, right? And so those who were already suffering from those mental health issues, it's really been compacted now.
Yeah, I'll agree. And I'll also add on an additional factor. During the pregnancy, visitors were once again limited to not even being able to attend ultrasounds or, prenatal visits. That really had an impact on mom's mental health. Going through a pregnancy alone and isolated leads to depression. So moms that already had mental health challenges were especially impacted, but moms who didn't, who never experienced it for the first time and had no idea what resources or what to even do with those feelings. Delivering for some of our mothers that were COVID positive that delivered alone, and then had their first, if it was a C-section, had 2 to 3 nights in a hospital alone, in a room with their baby. They suffered from some, post-traumatic stress from that experience. It is intense.
Wow, those are really powerful. That's a powerful testimony. I'm just reflecting on that. Thank you, Lindsay. We did get another question in the chat. Lisa had another breastfeeding question about supplements and teas, and are they valid or more old wise tales? And I'm so glad you're bringing up breastfeeding questions, because at the Breastfeeding Coalition, we love to talk about that stuff. We're actually running short on time. So Jaleesa, I'm going to encourage you to please attend one of the many support groups that we've been talking about that are available to you, because we would love to talk more about that. And it's such an important thing. Many of our clients that we're experiencing are dealing with that, and they're trying to figure out what's true and what's not. As we get to our close, there's one question I want everyone to answer. And that is, what are some positive things, takeaways during your journey of pregnancy or providing care for families that you have experienced over the last several months or during the pandemic? What's a positive takeaway from this experience?
I can go. I think the most positive thing that I always carry with me is to encourage my families to focus on the strengths, not so much of the disparities that they face naturally. A lot of us forget that we all go through things in life, but it's important to, focus on the positive more than the negative. And that helps my families to see that every situation isn't the worst situation that they face.
I agree with that. I would also add that, that there are resources out there, right? We're 3 or 4 on this call alone. 4 families, pregnant women, they don't have to be alone, right? There is support out there. There's still in-person support, there's virtual support. So, Kaylin didn't have to go through this on her own, right? There are resources out there that she could have been referred to. And so we just want to make sure that we're helping people get connected to the needed services and resources in the community.
And I just want to add, if anyone has an additional resource, or if you need information on a resource, you can always reach out to myself or Katie Kenyon at the foundation. She'll put our information in the chat box for you.
I just want to add, as far as some positive takeaways during this situation, I would say that for some mothers, they were able to spend more time being at home. We all know that the family thrives when mom is home and able to dedicate time to her family. Moms were able to come home and maybe not rush back to work. Maybe not been an ideal situation, not, for not needing to rush back to work, but maybe take that time to address her baby's nutritional needs, work on some things that she hadn't had time to self-reflect, take some time for mental health, self-care, just things like that. So there were some positives.
I want to thank you guys for answering all those questions and for being patient. Since it is still Black Maternal Health Week, there are some events still happening. So we want to thank you for attending our panel, our first panel, and there are many more to come. There is a Speak, Move, and Change. It's a Black Maternal Health series presenting Black Wombs Matter, an exploration of Black maternal health crisis around the world. It's presenting Friday from 7 to 8:30 p.m. Eastern Time. For more information, Katie is going to include it in the chat box. Again, if anyone knows of local or virtual events happening through the weekend for Black Maternal Health Week, please put it in the chat. It will be shared and emailed to everyone. I want to thank our wonderful panelists for coming on today and gifting us the information we need to continue to educate our communities and advocate for ourselves. I also want to send a special shout out to Katie Kenyon, who is working behind the scenes, working the chat in the whole webinar. So thank you, Katie. Shauna, is there anything you would like to add?
Yes, I just want to thank everyone, all of our panelists, all of our attendees today. We're so thankful that you all came out for this very important discussion around the power of support and supporting our Black families. Thank you so much. Enjoy your day, everyone.
Thank you.